Hello and welcome to the Saturday, April 18th edition of the Daily Situation Report for Thunder Bay Regional Health Sciences Center's COVID-19 response. My name is Tracie Smith. I'm Information Officer with the Incident Management Team, and I am here with Incident Manager Dr. Stewart Kennedy. Dr. Kennedy, the COVID-19 testing situation continues to evolve, and there is some positive development. Can you share the details?
Yes, Tracy, we're making some good progress in turnaround times at Thunder Bay Regional Hospital. I think it's a concerted effort by the province as well as Ontario Health North, and things are certainly going in the right direction. We have our turnaround time has now gone from 5 to 7 days to 3 to 4 days, and I even expect it may get down to 3 days, over the next several days. And that's because of a number of factors. I think we have daily transportation down to Toronto to the Public Health Lab, and we also have been prioritized at the Public Health Lab in Toronto to get results back to Thunder Bay in a more timely fashion. So I think everybody's working together. But there's all other initiatives going on at the same time. As I think I announced yesterday, Public Health Ontario is looking at putting an on-site module here at the unit Public Health Lab in Thunder Bay, which will go a long way to enhance testing once it's here and established within, I hope, 1 or 2 weeks. And that's been a great effort by all parties. We also have limited capacity to do in-house testing here at Thunder Bay, given our pre-existing technology, but now we've got some additional test kits. Only 80 test kits, so we have to prioritize who gets those in a timely sort of turnaround time of several hours, but we have a good process to identify prioritization of who gets that 1 or 2 hour turnaround time. In fact, as we speak, this morning we've actually approved one to go on a fairly rapid basis because they were sort of had a patient that was involved to a vulnerable population, so we're doing that test as we speak. So it's great because it enhances patient care and reduces less risk to our patients and other vulnerable populations within the hospital.
That's really great news, and it's a wonderful demonstration of the collaboration between our health system partners, our political leaders. It's been wonderful. Thank you for your work in that area. Things are also moving forward regarding recovery planning. What are the first steps in that?
So certainly we need to get back to business to take care of the healthcare needs of everybody in this region, and I think it's well known that we need to get a plan together to have a stepwise approach based on prioritization of healthcare needs to move forward. So we've put Jessica Lagozo, who's our EVP for regional affairs and sort of collaboration systems to actually lead this, and she'll simulate a team of leaders, physicians, as well as the amount of staff she requires to put a comprehensive plan together so we can start looking forward to getting back to normal business. When that is going to occur, we're uncertain. We follow advice from Public Health Ontario, we follow advice from Ontario Health North, we follow advice from the Ministry of Health. But again, we are unique. In the sense when we say we're unique, we haven't seen the steep rise of cases in northwestern Ontario. So we have to make sure we move in a safe way, but also into a sort of a logical way that identifies that we're in a unique situation in northwestern Ontario, being the only sort of regional hospital within 900 miles. And also, we haven't seen the sharp rise in individual cases of COVID-19. So we need to get this plan together, and it's really for the safety of the community as well as the region to be available for business that has really has been a concern for all of us, that we are going to see a backlog of surgical cases, of medical cases, so in outpatient cases, MRIs, CT scans, that we need to begin in a calculated way to start ramping up service.
So this actually provides a good opportunity to apply some of the things we've learned through our response to COVID-19 to how we operate in the future and in the coming weeks and months and years. What sort of learnings do you think can be applied?
I can safely say from our learnings with COVID-19, the hospital environment will not get back to where it was previously. Infection disease is so critical within a hospital environment, and control of infectious disease is so critical that we need to put in additional measures as we get back into normal business that will take into the needs both of the community but as well as our hospital staff. And so we've learned a lot with COVID-19 and are still learning enormous amounts. So I can't tell you exactly what measures we're going to maintain, but business will not be as usual as you saw them even 3 months ago.
I'm sure that will be the same in many aspects across daily life. Lots of
Yes.
learnings to apply.
Yeah.
So finally, I just want to check in on the screening criteria. At our hospital entrances, as of this morning, the new criteria was applied, meaning that we went from 2 symptoms down to 1 of 7 symptoms for criteria. How did things go?
As you know, we had to be more aggressive in our testing, and we have to enhance the safety of for patients and staff in the hospital. So we are now online to follow the guidelines recommended by Public Health several days ago. And because of the decreased turnaround time, that's enabled us to safely put these new guidelines in place. There was a concern, given 1 symptom, that we would have a lot of staff not be able to report to work because of 1 symptom. But it's safe to say that I think as of this morning, I think we just had 3 staff fail their test, and then they were sent home to self-isolate, and they will actually be tested so we can get them back to work in a timely fashion. And we still have 36 staff remaining off work until their tests are confirmed, but because of our enhanced turnaround time, we'll get them back to the working environment in a more expedient fashion than we were last week. So I think things went better than expected. Those same criteria are going to be applied to public health. And so we're doing increased testing at our assessment center, and then we also increased testing in the emergency department and our inpatient units based on the new criteria. So it's all, again, to protect the public and protect our healthcare workers. So I can safely say we're increasing the testing and we're going the right direction because we have enhanced turnaround time.
It's wonderful news. The community has been asking for this, and it's great to be able to respond.
Yes.
Thank you, Dr. Kennedy, and we'll see you again.
Thank you.